My name is Dr. Tushar Mehta. I'm from Canada, and I did my residency there in family medicine. I've also practiced addictions medicine, and I've mostly practiced emergency medicine, or what you call A&E in some countries. I have an interest in international health, and I do work in India and a few other places. And on top of that, I have a strong interest in plant-based diet and health. So when I say plant-based diet and health, you can also say vegan diet and health. And I'm here on behalf of Hina Modi and plantshift.com. Okay, Dr. Tushar Mehta back again for plantshift.com, and we're going to talk about plant-based diet and dementia. Now, dementia, Alzheimer's disease, is a devastating disease. The two most devastating and most common, two very devastating and common diseases that I see as a physician all the time are cancer and Alzheimer's or dementia. Okay, with Alzheimer's, in both these diseases, in Alzheimer's as well, you see people who are wasting away, their brains function deteriorating significantly, and eventually they have problems with memory, recognition of people even that they know, depression, decreased mobility, decreased activities, all kinds of things that have a remarkable impact on a person. And you see your loved one sort of just wasting away in front of you. So it's really tragic for the whole family, okay? Devastating disease, I wouldn't wish it on anybody. So is there a link between animal protein or animal fats and dementia? Is there an advantage for a plant-based diet? Now, this is one of the studies where this is one of the diseases where we don't have as much information directly. So direct information would be like this. If we had a group of plant-based subjects, so vegans, vegetarians, or like that, and we watched them until their very old age, and we measured the amount of people who had Alzheimer's disease or dementia in the different groups, the vegan, the vegetarian, and so forth, and see what the effect of progressive amounts of animal protein and fat had on a person. So far, these kind of studies haven't been done, or at least that kind of data hasn't been collected. Maybe there were some opportunities, but I haven't seen it, okay? What we do have is a few other things. We know that there are risk factors for dementia. One of them is genetics, okay? Low education is also a greater risk factor. Having more education is protective to some degree, okay? Smoking is bad. High blood pressure is bad. Diabetes is bad. And lack of exercise, sedentary lifestyle, that's also bad. Having depression and being inactive is also bad. So these are all risk factors for having Alzheimer's and for having dementia. All right. Now, some of them are modifiable. We know that people on a plant-based diet have less blood pressure problems. They have lower blood pressure. They have less cholesterol. They have less diabetes. Okay. So those are things that definitely can be improved by a plant-based diet. What we see, so there may well be a connection that those on a plant-based diet improve those risk factors and thereby have less dementia. So that's what I say about indirect evidence that a plant-based diet may be beneficial for dementia. There are some other things. There's a good study called Midlife Serum Cholesterol and Increased Risk of Alzheimer's and Vascular Dementia in 3 decades later. So in this particular study, what they did was, it was in the German journal called Dementia, and what they did was they took people, they looked at people who had and they saw some elderly people, those who had dementia and didn't have dementia, and they looked at their cholesterol records from when they were from 30 years before. And what they found was that those people who had higher cholesterol levels during their midlife had higher levels of dementia later on. Okay, it shows that cholesterol, even earlier in life, could be having effects on the blood vessels of the brain, narrowing those blood vessels, and therefore setting you up for getting dementia later on. As a doctor, when we do CAT scans on people for various reasons, we often see people who have dementia have kind of more shrunken brains, and they have tiny little old strokes around their brain. You kind of get this Swiss cheese effect with lots of little strokes going on. So that's kind of a practical thing that we see on a day-to-day basis whenever we do a CT scan, that dementia is composed of little strokes as well. That's a component of it. Blood vessel disease is a component of it. And there's a bunch of other papers showing that people who have higher amounts of cholesterol and vascular disease, that being linked to dementia. When they do things like autopsies on people with dementia, they found more cholesterol and blood vessel diseases, and there's all kinds of links of they find these amyloid plaques, these plaques that develop in the brain of those people who have dementia, but the plaques are also linked to having high cholesterol and having narrowed blood vessels due to vascular disease. So there's more and more studies showing this over and over again, and so it seems to be a great link here. So we haven't directly seen the studies showing plant-based diet people have less dementia, but we have a lot of evidence that shows that this could be a really significant link. All right. So again, if you were one of these people who want to prevent, I think there's enough here to say that, a good way to try and prevent something that may be in your family history is to exercise, is to stop smoking, lose weight, keep mentally active, keep fit, all these things, but also a plant-based diet, looking at your saturated fat, preventing diabetes, and your cholesterol and everything as well. Okay, so there may be a significant link here. Take a look at the studies. I'm going to have some good links in there where there's a lot of journals linking the idea of cholesterol as a serious cause of dementia and vascular disease as a serious cause of dementia. All right, thanks very much. Hope you enjoyed the video, and I'll see you in the next one. So the references for every single video that I have are going to be downloadable from the description box, where you can click and download the entire set of references, and then just scroll down to the relevant references. If it's a video on diabetes or cancer or something like that, scroll down to the relevant section and take a look at the references that I'm speaking about. In my videos, I'll generally discuss one reference, but it's going to take too long to discuss 10 references and you'll be bored out of your mind. So I'll discuss one, and then you can go into the reference list and look at more references that are talking about the same topic. And it's important not just to have one reference, but to have multiple references that discuss a topic, because then you're seeing that different studies are being done in different places by different people, and they're getting similar results that are reinforcing each other. Okay, so that's another good thing to look at.